Good afternoon, everyone. We are back again with yet another informative session on our Facebook Live by Sharda Hospital, Greater Noida. My name is Shrinkla and I will be hosting this insightful discussion today. This World IVF Day, we have with us our expert, Dr. Vikas Yadav. Dr. Yadav is a Gynae laparoscopic surgeon and IVF specialist at Sharda Hospital, Greater Noida. Thank you, sir, for joining us today.
Thank you, Shrinkla, for inviting me here and for such a great initiative that at Sharda we are taking. Thanks once again.
Thank you, sir. You're welcome. And before we start this session, let me introduce Dr. Yadav to you. Dr. Yadav has more than 12 years of experience in the field of IVF. Sir has handled numerous complex medical cases and is well known for his attention to detail, accurate diagnosis, and treating patients with empathy. So today in this session, we will be discussing about IVF myths and facts. So Dr. Yadav, please enlighten our audience on what exactly is IVF.
So first let me tell you what is IVF. So IVF is basically a type of treatment for infertility. So first let me tell you what is infertility. In our OPDs, when we see a patient that after marriage and after 1 year of unprotected sexual intercourse and they are not able to conceive, then we diagnose it as infertility. And in patients above age of 35 years or with some clinical complications, even if 6 months have passed and yet they are not able to conceive, then we call it as infertility. And for infertility, we have various techniques and IVF is one among them. And let me tell you, in this today is one of the auspicious day. Let me tell you about a small history of IVF. So it was back in 1978, 25th July is considered as World IVF Day because on 25th July 1978 in UK first IVF baby was born. So for India, it was the second IVF baby was an Indian IVF baby known as Kanupriya. Her name is Kanupriya, and it was in 1978 October that she was born. And it is a great thing for our Indians that if you go back in mythology, in Mahabharata and all, you see Kunti giving birth to Karna, the Devki, the embryo is getting transferred to Rohini and Balram was born. So we will come across so many stories of IVF. So in Indian, so the technology was first discovered by Indian, and this technology which was discovered in 1978 by Dr. Mukhopadhyay in India is still continuing as a leading mark for every IVF which is going on in world today.
Thank you, sir. That is so insightful to get the not only the detail on what IVF exactly is, but also the history and how you've related it with mythology, and again Indians being proud of one more hat added to their name. So IVF, can we have the full form just for the people who might not know and what exactly undergoes in the process of IVF?
Yes, Shrinkla. So infertility, when we say infertility, so the treatment parts includes various techniques. So it is not like every couple needs IVF. So we have different techniques to cater the demand and the cause of infertility. So basically, if you say we have male factor and female factor, we have two factors. So in females also, if we are able to correct surgically, we go for surgical correction. If there is a hormonal disbalance, we use medication. And if everything we have tried and we see that results can be better with in vitro fertilization, that is IVF, then we suggest the patient to go for in vitro fertilization. So let me tell you a little bit more about infertility. So in infertility, in female infertility, there are various causes, but the most common will be the difficulty in ovulation. So there can be difficulty in ovulation. There can be some tubal factors like there are patients which come to OPD and say, Dr. साहब हमें बताया कि ट्यूब बंद है. So that can be a cause, tubal factor can be a cause, or there can be causes related to uterus. Like we know there are conditions like endometriosis and all, and these conditions can affect the female fertility. And in male there are various causes. There can be decreased sperm count kam hona, motility is less, there are the morphology is not good. So we can treat the morphology and male infertility part also, but in the broad spectrum we have assisted reproductive techniques. Under that we have in vitro fertilization, and we also have different various techniques that we offer at Sharda IVF also. We have in vitro fertilization, we have intrauterine insemination, we have artificial insemination, then we have various techniques for male factor also. We do PISA, TISA, MISA, and basically we are able to, with the advent in technology, we are able to retrieve even a single sperm from male. So we have so much advance in our setup. So in vitro fertilization is a part of ART techniques, and we have different techniques depending on the need of the patient and how the patient needs.
बिल्कुल सर. एंड आप इनफर्टिलिटी की बात कर रहे थे, तो व्हाट इज द राइट टाइम, कब एग्जैक्टली किसी को जाना चाहिए कि नाउ इज द टाइम व्हेन वी कैन गो टू एन इनफर्टिलिटी स्पेशलिस्ट?
Yes, Shankala, actually the patients come to us usually in the educated scenario. Patients getting married late. So कई बार patient आते हैं 35 years के बाद and they say कि डॉक्टर साहब 7 month 8 month हुए हैं and we have problems, the periods are not regular. Then we can go for investigation. We have different investigation. We tell the patient कि आप investigations कराइए. We have to check hormones. We check the hormone profile. So basically we check कि ovaries में जो reserve हैं वो ठीक हैं कि नहीं. So we tell the patients कि first we get the test for male, कि हम पहले देखते हैं कि semen analysis ठीक है कि नहीं. For females we check if uterus is normal, we check tube ठीक है कि नहीं, patency ठीक है कि नहीं tubes की, and for ovaries we check hormones ठीक हैं कि नहीं. If all these are normal, then we tell the patient to try for normal conception, or second step is we assist ovulation. मतलब हम दवाई देते हैं, we give some medication, we tell the patient to take these medication, tell the patient to follow with us. Patient follow with us, we do serial ultrasound, we do follicular monitoring, we do follicular studies, and if needed we go for intrauterine insemination. This is also one of the technique in IVF where we can offer the patient intrauterine insemination. अगर IUI के 6 to 9 cycle भी हो जाती है and patient is not able to conceive, then only we tell the patient now they can opt for IVF. Regarding the age that you asked कि right age क्या है for infertility, it's not like कि IVF आप कभी तक भी करा सकते हो. In fact now the new law has come. It's like after 50-55 years we do not tell the patient to opt for any fertility measures because it is going to affect the patient also. So the right time will be if 1 year 2 year have passed, patient should consult an infertility specialist. She should get checked and then we can proceed accordingly.
Okay, wonderful. Thank you so much for the insight, Dr. Yadav. What tests need to be performed before starting the IVF treatment?
So before starting the IVF treatment, we start with the first test which we say that a couple, and mind you, when we say about the infertility, I always say that both husband and wife should come to infertility OPD. It is not like कि wife आ गई and she is saying कि डॉक्टर साहब आप मेरा कर लीजिए पहले और husband आते रहेंगे. It is not like that. So we always counsel and investigate couple as a whole. So majority, when you see the causes of infertility also, you will see that male infertility contribute around 30 to 40% of the cause. So going by this fact, we order first, we tell the patient to get a husband semen analysis. We check semen analysis for the husband. Now coming for the female part, in the female part we ask the patient about the menstrual problem, whether she is facing any menstrual problem or not. We do ultrasound, we follow the follicles, we do serial follicular monitoring, and we, after checking the hormone levels, we also do the tubal patency. If tubal patency is okay and all tests comes out to be normal, we then go for ovulation induction. That is, we start the patient with giving simple medication. These are not costly, but the thing is ki patient has to follow up. Patient has to take the medicine. She has to come to our OPD. She has to come for the ultrasound, where we check whether the ovaries are functioning normally or not. Ovaries काम कर रही हैं, patient is coming to our OPD. So we tell the patient, at the right time, we give some injection which are there in IVF and IUI, and we can plan the patient on ovulation induction or artificial insemination or IUI. And if things does not work even after 6 to 9 cycles, and if the age is more than 35, or if there is any problem in the different test, then we tell the patient to go for in vitro fertilization.
Okay, wonderful. How long would it take an IVF procedure to complete? जैसे आपने कहा 6 से 9 होता है, तो उसका क्या duration है?
So when I told you about the IUI, so 6 to 9 cycle means each cycle is being done in each menstrual cycle. So every female has a cycle of around 24 to 38 days. So in 24 से 38 दिन के इस दौरान ही we try to finish one cycle. So it's around 6 to 9 cycles we try for ovulation induction and IUI, and if it fails, then we do go for in vitro fertilization. So let me tell you how the in vitro fertilization works. So in vitro fertilization, we start the patient on injectables from second day of her cycle. So patient is asked to come to our OPD. Before coming to OPD, she has been following with us. हमने पहले से investigation कराए हैं. We have counseled thoroughly, and at Sharda IVF we have a separate dedicated genetic counselor, psychological counselor, andrologist, and a team of nursing staff which take good care of the patients so that no question is left. So on second day of the cycle, we start the injection, and it's matter of 12 to 14 days when we give the injections. So we give 12 to 14 days of injections, and then we aspirate the eggs, we do IVF, we do ovum pickup, and we freeze the embryo. And on the next cycle, we transfer those embryos. So it is a matter of 12 to 15 days, and for that also patient needs to come for injection. And nowadays we have a pen device which patient can self-administer. So it is subcutaneous. So sometimes patient पूछते हैं कि डॉक्टर साहब बहुत ज़्यादा दर्द होगा क्या, बहुत ज़्यादा painful होगा? तो it is not like that. Nowadays with the technology we have subcutaneous injections, so patient can administer herself. So it is home device. And at Sharda we have nursing staff which also do a WhatsApp video call and take care that they are getting it administered perfectly on the right position, on the right side, so that she does not face any difficulty.
Well, I think that will be very helpful. वो अगला question आएगा भी, मैं आपसे पूछूंगी. But what are the potential side effects of undergoing IVF?
Okay, so there are some myths. So patients do ask me कि डॉक्टर साहब अगर हम 3 साइकिल के बाद IVF कराएं तो इसका मतलब है कि क्या अब हम बाद में IUI नहीं करा सकते? क्या एक बार IVF हो गया तो हम बार बार IVF कराएं? या ये भी कई बार कोई क्वेश्चन पूछते हैं पेशेंट्स कि डॉक्टर साहब कितनी बार मैक्सिमम हम IVF करा सकते हैं? सो गोइंग विद द साइड इफेक्ट्स, देयर इज नॉट मच साइड इफेक्ट्स. We don't give such a high dose that ovaries gets hyperstimulated. It is not like that. We give the optimum dosing to the patient. Sirf in that cycle, the ovaries gets. So the small side effects which patient do tell us, to be frank, is that they say that there is a little bit of bloating sensation. They say that there is a nauseating feeling. There is some patients do tell us about headaches, little bit of headache, but eventually what I see is ki with good counseling which we have here, so these are well taken care of, because we don't want patients to take extra medicine which are going to interfere with our injections.
Right. And I think these symptoms are anyway बहुत कई बार बहुत common होते हैं for any sort of
for any sort.
So not much I would say in
there
summary,
are
not much very like negative side effects of undergoing IVF. So sir, IVF जैसे आप बता रहे थे painful नहीं होता है अब injection, but the process of IVF, is it just a question for a general public, is it painful?
The process of I think IVF has much of the psychological stress from the patient,
yes,
rather than the pain part.
Right.
So patient has come after having so much faith in you. She has so much of psychological pressure, because we can't just see the patient and tell कि अब शुरू होगा. We have to ask her about her psychological state. We have to cater that also, because कई बार पेशेंट कई जगह गया है, कई बार पेशेंट का, एंड माइंड यू 50% ऑफ पेशेंट हैव सो मच ऑफ फैमिली स्ट्रेस कि दे वांट दिस टू बी सक्सेसफुल. सो बट आई यूजुअली टेल द पेशेंट टू सी सम कॉमेडी शोज, बी स्ट्रेस फ्री, डू योगा एंड ऑल, बट आई वांट माई पेशेंट्स टू बी स्ट्रेस फ्री. So the pain part is not much, as I told you कि आजकल injections subcutaneous आ रहे हैं, so patient can take below the tummy, and these are very fine needles. These are thinner than the thorn. Okay. So these you can't even you don't feel these injections, and patients are taking they are getting self-administered. Okay. And we are guiding, and they are also taking at home. So the pain part is not much. So I think the main part is the psychological pressure which they have, which we really need to cater in all these patients.
Definitely, I think it's very commendable on how you're treating your patients when you're saying the stress-free zone is very important, because we know there are a lot of underlying complications that a patient goes, let it be family or let it be your own health, what will happen after this and before this. So I think that's very commendable. And आप बात करते आ रहे हैं, हम मतलब शारदा हॉस्पिटल में बहुत सारी चीज़ें हो रही हैं. फॉर एग्जांपल व्हाट्सएप वीडियो कॉल कर पा रहे हैं वो नर्सेस को, और काउंसलर्स हैं, साइकोलॉजिस्ट हैं. सो उसी को समराइज करते हुए, सर, व्हाट आर द फैसिलिटीज एंड ट्रीटमेंट्स दैट आर अवेलेबल फॉर IVF एट शारदा हॉस्पिटल?
So the thing is कि I have worked in many IVF center. I was before that in AIMS. I also seen IVF center in Noida, various regions. So what I am not over exaggerating anything, but what makes us apart, Sharda IVF Center apart, is that we have such a stress-free environment. Whenever you enter the Sharda IVF, we have the very smiling babies, pictures of babies smiling. We have a very good staff which will take care of you. They will counsel even before me coming in the picture. They will start asking patient कि कैसे हो, what makes you come here, and for every visit they tend to counsel the patient. So now our center has a very big area. So we have a dedicated facility for andrology. We have made each separate unit for each and everything. For male infertility, we have designated andrologist, Dr. Parmeshwari is there. She has experience of I think 10 to 12 years. Embryologist has worked pan India and pan international. She's been going to Bangladesh, she's been going to Nepal, Dhaka, Dubai, and she has experience for around 20-25 years. Dr. Rekha is there. And we have so well trained staff. We are catering the facility, high-end facilities like 𝐂𝐿, donor oocyte. We have male infertility factors. For the male infertility, we have urologist Dr. Vijay also helping us out in cases of TESE and all. So it is so what makes us is that we have a very good dedicated team, and we actually want our patient to have a good effect. And good, of course, good results. This is what we aim for. And also, we want patients to be stress-free and a smooth OPDs and all. So we try to achieve that in every patient so that they feel good.
It sounds wonderful. I think it's a very helpful team and a very experienced team that we have with us at Sharda Hospital. So what is the success rate of the facility in terms of live births and pregnancy rates?
So I think this is some question. There are success rates that we try every center try to tell about 90 to 100%, but it's not like that. So in IVF, in the best and best of centers, when I worked, I went to Germany and UK, I saw that even they have success of around 50 to 60%. At Sharda, to be honest, we have success of around 50 to 70%, depending on the cycles. For frozen cycles, we have success around 70%, and for the fresh cycles, we can say around 50% around the results are there. So the IVF, usually the results vary from 30 to 70% depending on the setup, depending on how good your embryologist, andrologist, and of course IVF specialist should be good.
Great. Thank you so much. So we also have few questions in the comment section of our Facebook Live, which we would like you to answer. So I'll just open up the questions real quick. Yes.
Yeah,
so we have a question by Ms. Shreya Gupta. Can IVF resolve all infertility issues?
So around IVF, we first check all the issues which are there with the patient. Like I told you, we see the male factors, we see the female factors. We first try to resolve those issues, and if we see that we are better off with IVF and we see कि IVF में results अच्छे होंगे rather than going for anything, then we try to tell the patient for IVF, because IVF, whatever the thing is, IVF becomes a little economical for the patient. So we try to correct as much as things which are there with the patients, and then we go for IVF. But it's not like if ovaries are not good, if uterus is not good, then she can conceive by IVF. This is also a myth. It's not like if things are not good, IVF is not going to help much.
Thank you so much for clarifying that. And another question, cost related, right now it was on my mind as well, that is IVF expensive? That's a question by Ms. Akshita Jain.
So at Sharda, I think we are the most economical and affordable IVF center till now in whole NCR. I can proudly say that, because our cost package is very low. We have kept the cost factors within 50 to 70,000, and we do not take. I see many patients coming to us with a list of around. There was a patient who was coming to 30 and 35 things. That for this thing they are charging 10,000. For this thing they are charging 15,000. So I should tell you that we don't charge anything extra. This is the package in which we have included everything, because for us the happiness of the patient matters more than this cost part.
Definitely. Thank you so much for clarifying that. Then Rahul Sharma asks that is IVF only applicable for young couples?
So it's not like IVF is only for young couples. Young couples have various other things. They can go for ovulation induction. Like we can give some medicine and they can follow with follicular monitoring with your IVF specialist. If that does not work, we check for any surgically correctable cause. If there can be found, then we do correct with any surgery. If there is hormone imbalance, we correct with the hormone balancing drugs. And if all those things we see that patient is better with IVF, then we'll tell the patient for going for IVF. But if the couples are at the age of more than 37 weeks, 37 years or 35 years, where we know that ovaries are aging fast, then we tell the patient to get the help of IVF so that the chances of conceiving are more.
Okay, thank you for clarifying that, Dr. Yadav. What is, Niharika is asking a question, what is the success rate of IVF? I think that you answered
yeah.
already.
So let me tell you about the Sharda IVF. So as we are telling about the lab part, as we are telling about the success part, so it gives me immense pleasure to tell you that at Sharda IVF Center, we are the first who had opened IVF around 3 years back. We did not stop in second wave of COVID. We have success of around 50 to 70%, and also ours was the first baby of the Greater Noida, which was born at Sharda IVF Center, and we can proudly say that the baby, I think the baby name was Gaurav, and baby was the couple came all the way from AIMS because I think those centers were not doing at that time, and she conceived in first cycle. The baby boy was the first IVF baby of Greater Noida. And after that, there were many couples who came from different part from NCR region. Some had 2 cycles failed, some had 3 cycles failed. But we were able to achieve clinical pregnancy then also.
That's wonderful, and congratulations on
Thanks,
having the first baby boy here. Rohit Nanda asks, is IVF safe?
So IVF is safe if done protocol-wise. So if we are following proper regime, proper stimulation protocols, we are not going over exaggerated drugs, we are not giving too much of high doses of drugs, because sometimes they say 1 to 2% of cases land up in hyper stimulated ovaries. So if ovaries get stimulated too much, then it can lead to bloating, some kind of respiratory distress and all, but it is very low. It is around 1 to 2%, and with good stimulation protocols and good follow-up of the patient, this does not happen.
Okay. I think that answers your question, Rohit. Snigdha Roy wants to ask, does IVF procedure contributes to any hormonal disbalances in the menstrual cycle postpartum?
So after the IVF cycle, usually we keep the patient on some progesterone, and whenever the patient stops those drugs, she will get the periods regularly. So we do not see much of the menstrual irregularity problem after IVF. It can be because of the hormone imbalance which is there as such in the patient, which has caused the menstrual irregularity. But these medications can cause menstrual irregularity for 1 cycle or 2 maximum, but not in a long term.
So not in a regular basis. Okay. All right. Great. And Sir Ananya asks, what is frozen embryos, and what is better, frozen embryo or fresh embryos?
With advent of technology, now you see, I told you that we give in IVF 12 to 14 days we give injection, and after 14 days of injection we take out the oocytes, and in the embryology lab we make embryo. So embryo is like a small fetus we have. So if we are going to transfer the fetus in that cycle only, the cycle in which we have aspirated the eggs, so we say that it is a fresh embryo transfer. But if we are going to freeze that embryo and in the next cycle we are going to transfer it, then we say that is frozen embryo transfer or FET. So the clinical evidence say that fresh embryo transfer, comparing fresh embryo transfer and frozen embryo transfer, there is definitely upper hand in frozen embryo transfer. So because with increased medication we give in the fresh cycle, the uterine lining is not that good. So we, in the first cycle, we try to focus on the egg part, we freeze the embryo, and in the next cycle we transfer the embryo. So that is the frozen embryo transfer, and it definitely gives, and for us also, it is definitely giving us a better result.
Okay, great. So I think that answers your question, Ananya. Shuchi asks, is bed rest compulsory after IVF treatment?
Now this is also one of the things. कि कई बार patients come to us and they are accompanied by their sister or सासुमा and all, and सासुमा is like कि कब तक ये कुछ काम नहीं कर सकती. So this is one of the question they ask. So usually we tell the patient to have restricted activities for 1 day or 2. But apart from that, it is not like a patient is strictly bedridden. It's not like that. In fact, we tell the patient to be active because more she is coming back to normal. She is more stress free. The blood circulation is good. The blood is the part which is getting, the fetus is also getting. So it's not like a strict bedridden thing is not there. It is only on the day of transfer that we tell for half hour or so that she gets, she be there. And after 1 to 2 hours, we discharge the patient.
Okay, wonderful. And in between the treatment, is that also the case? Like after every injection or after every...
No, after injections are, say, most of the patients at our center are taking injection self. Okay. So they are self-administering the injection. So there is nothing to be worried about. They are they are doing their routine activity. Many of them are working. They have job, and in the job part also. But the thing is, they have to take it timely. So if they are taking this today 10 o'clock, 12 o'clock, it's not like tomorrow they are taking a 5 p.m. So they only the thing is they have to follow a strict time regime. We do not want them to skip the injection. Just timely taking the injections will do, and only on the pickup day also we admit the patient in the morning hours. We do ovum pickup, and the ovum pickup is done under anesthesia. So patient will not feel pain. So pain is not there, and after 3 hours or so, 2 to 3 hours, patient is able to pass urine, and she can be, if she feels fine, she can go home. So in our practice, we never saw any patient waiting, or we had to keep her for admitted for night or so. So usually on the pickup day also she is getting discharged even after 2 or 3 hours. So
on the same day.
On the same day.
Wonderful. Thank you, sir. Pooja Sharma wants to ask, what does day 357 transfer means?
So the transfer is usually of day 3 and day 5. There is nothing called as day 7 transfer. So day 5 is called as blastocyst transfer. So blastocyst actually embryo we see on day 3, and day 3 is usually 16 cell stages. And day 3, if we have good amount of embryos, like I have 6-8 embryos, then I tell my embryologist that we can go for a blastocyst. Because usually from day 3 to day 5, some embryos tends to degrade, or we tends to lose some embryos from day 3 to day 5. Because day 5 are good, they are going to grow more. So best is blastocyst transfer, that is day 5. And in our frozen embryo cycles at our center also, we try to implant 2 good blast, which in most of the cases with blast transfer we are having around 70% success. So blast is anytime good for the patient.
Okay, wonderful. Thank you so much for clarifying that on the 3-5 transfer. Ashish Yadav wants to know, how many times can a couple try for IVF?
So now this is also a very good question, that patients do come, it's not like the number of cycle. So I have seen patients coming from different parts, because in India we have very economical pricing of the IVF. So patients coming after having 8-10 cycles of IVF also getting conceived here. And in our setup we have done patients after 4 to 5 cycles also. So there is not a definite number which I can say ki itne number ke baad I should say the patient ki she should stop. It is not like ki ab nahi kar sakte. So mostly in 3 to 4 cycles maximum patients do conceive.
Okay, all right. Okay, sir, and then Dr. Amit Singh wants to know that the weight of patient is also a concern on the success rate of IVF.
So this is actually nowadays in India we have a problem with obesity. You know that with obesity there is a problem called as PCOD, that is polycystic. So around 18 to 20%, the data says that 18 to 20% of females are getting this problem because of obesity. So ये obesity से actually होता क्या है is that कि obesity tends to imbalances these hormones. So if these hormones are getting disbalanced, so we do not get good quality eggs. So we first tell the patient, any obese patients who is crossing the BMI of 30 in the morbid range, we tell the patient to take 3 months, 6 months time, get the weight under check, do a vigorous routine exercise, so that her body weights come in a good category, and we can start some drugs which are so in those cases we do not get good eggs, but we have seen after 3 months or 6 months of weight exercises and maintaining the weight, the success rate improves. So comparing an obese with a normal patient, definitely normal female will have good ovarian reserve as compared to obese females.
I think that stands correct for a normal pregnancy as well. The weight is a factor. Then we have Deep Nair, that I've heard that IVF babies are born with birth defects and malformation. How true is that?
This is also a myth. So patients do ask us कि whether IVF हुआ है डॉक्टर साहब, तो ऐसा तो नहीं कि कुछ बीमारी होगी. And the good part is that कि patients are so much this thing that they follow us so routinely that it is good for us, because we are able to, if anything, we are able to detect early. But going to the data wise, it is till now, from 1978 to till now, the data does not show that there is any increase in congenital malformations associated with the IVF babies. It is not like that. So it is as equal to a general population, general patients getting conceived. So there is no increased risk of any congenital anomalies associated with IVF.
Great. I think that clarifies the question very well. And Vasudha wants to ask, does IVF pregnancy result in cesarean birth only?
Usually, if cesarean is not a dictum in cases of IVF, if patient in IVF, if patient has any medical comorbidity, any obstetrical comorbidity, like कुछ problem है, that if patient says कि BP बढ़ रहा है, she has any obstetric problem, then only we go for cesarean section. Otherwise, we can offer the patient normal vaginal delivery
as well. Okay, great. And Nishant Tyagi wants to ask that, is there anything that could negatively impact the IVF sessions?
So this is also a very good question. That the factors which can impact IVF cycle, first of all, obesity. If your weight is more, definitely we are not going to get very good eggs, and definitely if eggs are not good, the embryos will not be that good. Right. Secondly, if patient has so much, I have seen if patient has so much stress, that also somewhere hinders our result. Also, if patient is having IVF cycle, patient is getting injection, we tell the patient to be as natural as possible. I tell my patients to avoid all those perfumes, all those compounds which are not healthy for the body. So avoid these things and all, she should avoid. And be as natural as possible, avoid any fast foods and all, so that she does not get curve URT and LRT, because we do not want patients to have any chest infection at the time of IVF. So these are some of the precautions we tell the patient. That is why I told you that counseling is very important in such patients, that every time she comes to us and we tell the patient how's it going, how is she feeling, and how is the daily activities, what is she doing. Right. So this is the time we keep counseling our patients.
Definitely. I think you've, in a very detailed as well as very clear way, you've explained to us how IVF works and how Sharda is offering wonderful facilities at a very reasonable cost to all its patients, and a lot of myths also you have cleared for us, and definitely lifestyle modifications and a reduction of stress, etc. are very, very crucial for a good delivery, I would say. And then thank you so much for sharing this information with us, Dr. Yadav, and the session was very, very informative, and I'm sure our audience have got all the information that they deserved and that they wanted to know. Thank you so much.
Thanks, Shingla, and thanks for the audience.